Good day everyone. Hello, hi, mabuhay. I am Jan Ray Dakanay from BSN1 Henderson. I'll be doing a skeletal system video presentation and here the specific activities that we will show you in this video. First, we have the palpating surface anatomy of the lower limb, and second is demonstrating movement of the synovial joint. I now start to palpate the surface anatomy of my lower limb. Begin with, first, we have greater trochanter of the femur. This is easier to locate in women than in men because of the wider pelvis. Also, it is more likely to be covered by bulky muscle in men. It is the most lateral point of the proximal femur, and it typically lies 6 to 8 inches off the iliac crest. Second, patella and tibial tuberosity. I feel my kneecap or patella, and the patella is superior to the tibial tuberosity. The next set that I will show you is the lateral malleolus. This forms the outer part of the ankle, and fourth is the medial malleolus. These form the inner bulge of the ankle, and fifth is the calcaneus. In other terms, this is called the elbow. In this second video, we're going to take a look at the different movement that joint can perform. We're going through the movement like this example. Flexion, a movement generally in the sagittal plane that decreases the angle of joint and reduces the distance between the two bones. Flexion is typically of hinge joint, bending the knee or elbow, but it's also common at ball and socket joint, bending forward at the hip. Extension, a movement that increases the angle of joint and the distance between two bones, or straightening the knee or elbow. Tension is the opposite of flexion. Abduction, movement of the limb away from midline and medial plane of the body, generally on the frontal plane, or the fine movement of finger and toes when they are spread apart. Abduction, movement of a limb toward the middle of the body. Abduction is the opposite of abduction. Rotation, movement of a bone around its longitudinal axis. Rotation, a common movement of ball and socket joints. Also describe the movement of atlas around the odontoid process of the axis. Circumduction, a combination of flexion, extension, abduction, and adduction, commonly observed in the ball of socket joint like the shoulder. The proximal end of the limb remains stationary, and the distal end moves in a circle. The limb as whole outlines a cone. Pronation, a movement of the palm of the hand from the anterior or upward facing position to posterior or downward facing position. This action moves the distal end of the radius across the ulna so that the two bones form an X. Supination, movement of the palm from a posterior position to an anterior position, or the anatomical position. Supination is the opposite of pronation. During supination, the radius of ulna are parallel. Inversion, a movement that results in the medial turning of the sole of the foot. Eversion, a movement that results in the lateral turning of the sole of the foot, the opposite of inversion. Dorsiflexion, a movement of the ankle joint in dorsal direction, or standing on one heel. And lastly, the plantar flexion, a movement of the ankle joint in which the foot is flexed downward, or standing on one tooth or pointing the tooth.